So we also this year presented a poster looking at transfusions and the burden that comes along with those transfusions in patients with myelofibrosis. This is, of course, a very important issue. Anemia is very common in myelofibrosis and occurs in virtually everybody at some point in time in disease. And anemia can become severe to the point where people need transfusions to support their red blood cell count. And with therapies coming along that promise improving anemia, I think it's worth taking a look at transfusion burden and the downsides of that, and potentially how do we mesh that together with these new therapies. So in this analysis, we did a real-world claims database analysis for patients with myelofibrosis, and we found a couple of key findings. One is patients who are transfusion dependent get a lot of transfusions. And that's really important because our blood banking system is very stressed right now. There are always blood shortages. You may get pinged by the Red Cross frequently to donate blood, and that's because there are massive shortages. So it's a big strain in our healthcare system in general. Secondly, blood transfusions are expensive, and these patients with myelofibrosis are getting regular transfusions incur a big burden on our healthcare system as well, fiscally. As a side note, when we look at transplantation and the cost with doing transplantation, chemotherapy like busulfan is incredibly expensive, but the number 2 cost within that program is transfusions. So we know as cancer center directors and people who are looking at these operational data that transfusions are incredibly important, and limiting transfusions might actually be of greater value for an individual and for a healthcare delivery system. Lastly, we found that patients who are getting regular transfusions have more adverse events than those who are not. Now, certainly we know that transfusions can lead to worsening of quality of life and certain symptom burden, but adverse events are increased with those folks as well, and that can lead to, again, more increased healthcare costs. So the next question is, as we develop these new drugs, can we reduce transfusions, and can we reduce these adverse events, not only to improve patients' quality of life and symptom burden, but really to help benefit the healthcare system overall. And this is incredibly important because likely these new therapies are going to be expensive, and does that expense but the benefit and the expense outweigh the potential cost of doing transfusions?